In chapter 28, we're going to talk about acute kidney injury and chronic kidney disease. So, starting out with acute kidney injury or AKI, it's basically a broad spectrum of diseases that all range from minor changes in renal function to complete renal failure. And it's basically a sudden reduction of kidney function, hence the name acute kidney injury. And this could lead to things like disruptions in fluid, electrolyte, acid base homeostasis or balance. You might see the retention of nitrogenous wastes, an increase in serum creatinine, which are all indicative of a decrease in glomerular filtration rate. Now, there's three different etiologies or pathophysiologies of acute kidney injury. It can be pre-renal, post-renal, or intrinsic. If it's pre-renal, we're talking about something that involves, before the kidney. So this refers to blood vessels that supply the kidney. So disorders of renal perfusion. Post-renal refers to urine outflow. So if you see that there's disrupted or blocked urine outflow, this could lead to kidney injury. Or intrinsic kidney injury or circumstances within the kidney like blood vessels, tubules, glomeruli, or the interstitium of the kidney itself. So within the kidney is intrinsic kidney injury. Now with pre-renal kidney injury, it's basically due to conditions that diminish perfusion of the kidney. You can see decreased perfusion of the kidney during conditions like hypovolemia, hypotension, heart failure. So things like, all these things that may occur during shock or hypovolemic shock, even cardiogenic shock. Renal artery obstruction, so stenosis or narrowing of the renal artery. Things like fever, vomiting, diarrhea, because this can lead to excessive water loss. Burns, overuse of diuretics, again, because this can lead to excessive water loss. Edema and ascites. Now, ascites is edema of the abdominal area, but with both edema and ascites, you're having water loss, but it's water loss from blood into your tissues so that it leads to a decrease in blood volume. It's just maldistribution of fluids in your body. So you can see more fluids in the tissues rather than in your bloodstream. Excessive use of things like ACE inhibitors, angiotensin II blockers, and non-steroidal anti-inflammatories. All of these can lead to a decrease in kidney perfusion. Now, this differs from post-renal kidney injury because this is due to obstruction within the urinary collecting system. So what you'll see then is that due to a blockage of either the urethra, the bladder, or the ureter, this can lead to elevated pressure within Bowman's capsule, and this ultimately impedes glomerular filtration. Now, prolonged post-renal injury leads to acute tubular necrosis, and that can progress to intrinsic kidney injury. And if it continues, it can lead to irreversible kidney damage. Now, with intrinsic or intrarenal kidney injury, there's two main pathophysiological processes here. We have vascular and tubular diseases. Now, with the vascular form of injury, what we find is that renal blood flow within the kidney is decreased. Not to the kidney, but within it is decreased. This leads to hypoxia and vasoconstriction, and that can ultimately lead to ischemia and possibly even necrosis of basically kidney tissues. Now, tubular form of injury comes from inflammation and reperfusion injury. This can lead to things like casts, which can obstruct urine outflow and cause tubular back leak. And again, that can lead to further injury. Now, it can repair itself if the injury is reversed, but if that injury is sustained, it can lead to end-stage renal disease. Now, acute kidney injury differs from chronic kidney disease because this is more of an outcome of progressive and irrevocable loss of functional nephrons over time. So it's not an acute form of disorder, but it's more chronic. And this progressive process where you can see things like chronic kidney disease, which leads to chronic renal failure, and that ultimately leads to end-stage renal disease, or ESRD. Now, ESRD requires dialysis because this means basically your kidneys can't adequately help eliminate wastes from your body. Now, unfortunately, chronic kidney disease is actually a global health problem, and it's linked with other comorbidities like hypertension or diabetes. Now, with chronic kidney disease, what we find is that it's defined as a decrease in kidney function or kidney damage for 3 months, and this is based off of things like blood tests, urinalysis, and imaging. It's also defined as a GFR of less than 60 mils per minute for 3 months, with or without indication of damage to the kidney. So remember, a normal GFR is 125 mils per minute. If someone's GFR is less than 60 mils per minute for at least 3 months, even if there aren't additional signs or symptoms of of kidney disease, we still call this chronic kidney disease. Now, some of the complications of chronic kidney disease include things like hypertension. So, with the reason why you get hypertension from chronic kidney disease is that it leads to hypervolemia or high blood volume. Now, this can also escalate atherosclerotic process, and it leads to can be caused by things like a heightened RAAS or sympathetic nervous system activity. Now, chronic kidney disease can also lead to uremic syndrome, and this is a retention of metabolic wastes that can do things like impair healing, can lead to itchiness of skin, dermatitis, and even uremic frost, where the skin can attempt to eliminate nitrogenous wastes through sweat, and so it ends up forming kind of like a thin layer of what looks like frost on the skin, but it's actually due to nitrogenous wastes being eliminated through skin because the kidneys are failing to do so. Now, it can also lead to metabolic acidosis, where you might get retention of acidic waste products. Now, we know that the lungs can help eliminate, volatile acids like carbonic acid, but we need the kidneys to help eliminate other metabolic wastes that are non-volatile. Things that can't turn into a gas can't be eliminated by your lungs. So we could see metabolic acidosis from a retention of these wastes because the kidneys are failing to eliminate that. Now, this can lead to things like hyperkalemia, or even if the kidneys can't secrete hydrogen ion, that can lead to accumulation of a hydrogen ion in blood. You're also going to see electrolyte imbalances because of retained things like potassium, phosphorus, and magnesium. Bone and mineral disorders because of elevated phosphorus and parathyroid hormone causes altered bone and mineral metabolism, and the kidneys are unable to reabsorb calcium. So you might get excessive loss of calcium in urine. It can ultimately lead to also things like malnutrition because of decreased drive to want to eat. You'll see anorexia from uremic syndrome, depression, dietary limitations, even changes in taste, protein energy wasting, and negative nitrogen balance can all occur during chronic kidney disease. Now, we know that the kidneys also release the hormone erythropoietin. So if the kidneys are failing, they can't release erythropoietin, then this is going to lead to a decreased production of red blood cells. And you'll see this lead to things like anemia or even heart failure, which we call cardiorenal anemia syndrome, where if your anemia is so severe, it can lead to cardiac issues because of improper oxygen delivery to the heart. Now, chronic kidney disease can also lead to pain for a variety of reasons, but the disease itself may cause the pain. Otherwise, treatments and other comorbidities could be painful. And depression, from the disease itself, people can become depressed because of disruption of social interactions and relationships. But what's interesting too is that the accumulation of nitrogenous wastes, which we saw with uremic syndrome, can also lead to depression.